Yeah. Assalamu alaikum wa rahmatullahi ta'ala barakatuh. Good evening, my fellow panelists. Can you hear me? Hello. Hello, Ebou Cham. How are you?
I'm pretty good, sir. How are you?
Thank you. Kaddy, Barrow, how are you?
Good. How are you?
Fine, thanks. Dr. Wadda.
Yes, how are you, Fatou?
Dr. Fatou Wadda, how are you?
I'm fine, thank you. Alhamdulillah.
Nice to meet all of you. You for the first time and Dr. Ebou Cham for the first time. Kaddy is a regular here and very, very energetic lady. And it's not surprising. She was here before me. So, thank you, Kaddy.
You're welcome.
We're going to start by each and everyone introducing themselves, and let us be generous to ourselves. Who are Gambians are not very good at selling themselves here aside. So we will start with ladies and then men without beers. Then men with beers will come last. So the youngest, Kaddy, yeah, you want to introduce yourself, please.
Assalamu alaikum wa rahmatullahi. Good evening, everybody. My name is Kaddy Barrow. I'm a Gambian. I'm currently residing in the United States of America in Colorado. I'm a physician assistant. I work in inpatient acute care settings within the hospital. I've been doing this work for almost 6 years, but I'm not new to health education. I graduated at University of the Gambia in 2000 with a major in biology and minor in chemistry. I taught for 1 year at St. Joseph's High School. And then I joined the Nova Scotia Gambia Association Peer Health Education Program as the regional coordinator for Western Division. I was conducting health education within the schools in the Western Division area. I moved to the United States and pursued a master's degree in medical microbiology. I work as a lab technologist in microbiology labs in the hospital, and I also work as a forensic technologist at the medical examiner's office in Valhalla. Going into the medical field, I decided, well, since I've established family, I still have the ambition to pursue medicine. I joined the Long Island University Master's program in physician assistant, and my focus has been inpatient care medicine since I graduated. I am board certified in 4 states in the United States of America. Thank you.
Yeah, thank you very much, Kaddy. That's impressive resume. I believe Gambia can very much do right now with your expertise. Dr. Fatou Wadda, can you please introduce yourself to the viewers of Gunjur TV Online?
Assalamu alaikum wa rahmatullahi wa barakatuhu.
Wa alaikum salam.
My name is Wadda. I am a medical practitioner and I'm based in the United Kingdom. I'm probably the exact opposite of Kaddy in that I am nearing the end of my medical career. I did back in 1988 from the University of Nigeria, and I worked briefly at the Royal Victoria Hospital in the medical ward as well as the children's ward. My passion has always been pediatrics, and I came to the UK a few years after I went back home, so in the early 90s, and I worked for the NHS as a pediatrician and now as a neonatologist. So for those of you who don't know, neonatology is a subspecialty of pediatrics. We look after newborn babies, the ones who are born too soon, too small, and too sick. So basically the premature babies. Like I said, I've been in medical practice for over 30 years. So when I started medical practice, 28-week babies were essentially a miscarriage. And now we look after babies who are born 24 weeks premature. I work in a tertiary center, which is in West Sussex, and a teaching hospital. So my duties include teaching medical students as well as midwives and newly adopted physician's assistants as well as nursing assistants. And we run a 24-bed neonatal intensive care unit in one hospital and an 8-bedded special care unit in another hospital. So my experience is mainly pediatrics, and for the past 16 years has been neonatology. And I am passionate about pediatrics and, of course, neonates.
Yeah, thank you very much, Dr. Fatou Wadda. As that's again another impressive resume. We are a small nation, but we are mightily blessed. I'm not going to change the route, so I'm going to come to myself as I carry no beers. Then after I'll go to the Mansour. Yeah. So yeah, I am Ahmed Manjang, a native of Gunjur. I've been in Saudi Arabia for the past 8 years. I started my science career at Medical Research Council as a lab technician. 1994, 97, I traveled to UK, where I joined the University of Reading in 1999, and I graduated in microbiology with major in medical microbiology. In September 2002, I joined the University of Manchester, again in UK, where I did MSc in medical and molecular microbiology. And immediately after my master's, I joined a contract research institute called GR Micro in central London, where I work on 2 projects. That is an assay to develop 2 assays, one to detect Mycobacterium paratuberculosis, and other to detect Legionella pneumophilia. And after 1 year, I left Bristol. I left London. I joined Bristol Royal Infirmary as a trainee biomedical scientist, while at the same time I was completing my registration requirement at the University of West of England. And in April 2006, I went back to the Gambia, where I joined the MRC with the trachoma research project as a higher scientific officer. I worked on that project for 2 years. Then I joined another project in MRC called pneumococcal surveillance study. And our work in pneumococcal surveillance study culminated in lot of publications, and 4 of which were with Lancet infectious disease. So I am a troublesome guy, and I'm one of those who never use a fake profile while fighting against the dictatorship, and I end up having a problem fall out. So I need to find somewhere I safe haven. So that's why I end up in Saudi Arabia, the first opportunity. I work with a hospital called King Fahd Medical City, where I'm a senior lab technologist and also the coordinator for the research side of things. We've been working on hepatitis, sequencing of hepatitis B virus in the Middle East. But once COVID-19 come, it was a scramble. Everybody rushed to get a piece of it. So now currently we are working on COVID-19 asymptomatic abundance before it was actually announced in Saudi Arabia. Our paper is ready for publications, but we have a problem with the Ministry of Health, because they don't want to know COVID was actually circulating in Saudi Arabia, which we established a month before it was actually they identified their first case. So that's my modest introduction. I'm going to ask, somebody is opening another device which is bringing some noise. I don't know if somebody, I don't know. Okay, so Mr. Ebou, Dr. Ebou Cham, please introduce yourself to the viewers.
Thank you very much. Just a quick rectification. I am not a doctor. I am a certified registered nurse and anesthetist.
Okay, all right.
And I must say that your resume is absolutely terrible.
Thank you.
Anyway, jokes aside, my name is Ebou Cham. I am from Alberta village in Yomi, Alberta Jufure. And happy to tell you I'm not a Jaranka. In Gambia, I went to Alberta Primary School, and then later went on to Kotu Junior and Senior Secondary School. We were the first batch when they transitioned from the high school system to the middle and high school format back in 1992. I worked in forestry after graduation, did my little diploma in forestry in Gambia at Kafuta Forestry Training School, and went on to work as a forest guard and forest ranger in Kiangmanduar for almost 3 years. And then I came to the United States sometime back in 2002. I started out as a nursing assistant. I went on to become an LPN, what you call a licensed practical nurse. I became an RN and went on to get my bachelor's at the University of Washington, Bothell campus. I worked in the area hospitals as an RN and as an ICU RN in a hospital called Swedish Medical Center. And I went on to do anesthesia at Georgetown University in Washington, D.C. I completed that program sometime back in 2014, December of 2014, and I've been working. I came back to Seattle to stay with family, and I've been working at a hospital called Harborview Medical Center. It's in Seattle, Washington. It's a level 1 trauma center where we take care of burn victims, trauma victims, and stroke. It's also a big stroke center in the area. By virtue of its location in the Pacific Northwest side of the United States, we see trauma patients day in, day out, and some of them require emergent surgical interventions, and they cannot wait for their COVID tests. So that means that we have to, we always encounter people who may be showing symptoms already of COVID-19. And that's pretty much my little resume. Thank you very much.
Sorry, you are effectively a Kianka anyway. That's why it's all started for you. So, Mr. Mansour Ceesay, please introduce yourself to our viewers. So, how are we going to do this? If you are not talking, can we put our microphones mute? That is the small mic, so that we get as little interference as possible. Go ahead, please. Sorry about that interference.
Yeah, so I think it's very apt that you have a Kianka coming before everybody. The usual thing is they come in and then we make the road ready for us to come in. That's the usual practice. So I am Mansour Ceesay. I'm born in Sillah, Kenya, Badibu, Sillah, Kenya, and I went to the primary school there, the local primary school. And then I went to Hermitage in the late 70s, early 80s. Then I went to Gambia High School, where I did my A-levels. And I then had a short stint at the MRC labs in the Gambia, primarily in the hematology lab and the microbiology and biochemistry lab and microbiology, before I went to medical school in Freetown. Of course, in those days, there were no medical schools in the Gambia, so anyone who wanted to do medicine would have to have a scholarship or find the resources to be able to travel outside. So I went to Freetown, did my medical school there. In fact, we were the first batch to the foundation group that actually started the medical school in Freetown. And from then, I came back to the Gambia for some time, and I worked in the Gambia for a few years, about 4 years, and during which time I had an opportunity to do a degree in epidemiology, so an MSc degree at the London School of Hygiene and Tropical Medicine, and I briefly returned back to the Gambia. During that time, of course, it was a full-time course, and I was not practicing at the time. But the attraction of clinical medicine pulled me back, and I went back to clinical medicine. Then came to the UK to do my usual training, so general medical training first with the MRCP, and after that, then I decided to go to clinical hematology, and I've completed that training. I've been a consultant in hematology for the past almost 9 years now, I work at the King's College Hospital NHS Foundation Trust on 2 sides as a consultant hematologist. And my primary interest is actually around hematological malignancies, AML, MDS, and to some extent lymphoma type treatment. I mean, the interest of COVID, of course, is one that has been shared widely, and our primary interest is actually the focus is on the impact of COVID on patients who are having intensive chemotherapy. And as a result of COVID, we had to do a number of things to change our protocols, because as time goes on, it became quite clear that patients who are COVID positive while having that intensive chemotherapy have a rather poor outcome. So that's my interest. And of course, you know, it's a rapidly evolving field, and we're all learning very fast on it. And I think when I got invited to this, I thought it was an opportunity to share with Gambians the little experience I may have in the medical field and anything to contribute to awareness. Because I think one of the concerns that a lot of people have shared across the board is the fact that there were people, and to be fair, not only in the Gambia, but across the globe, where, you know, there are people who have doubts about the seriousness of this illness, or in fact the existence of COVID-19. And some of us who work in hospital day in, day out, even at the midst of the peak of the epidemic, where you know, serious lockdown, would have to go to work and see some of these patients unfortunately go through horrible times. So whatever I can share to make awareness to my fellow Gambians, that will be a privilege. Thank you very much for the opportunity.
Yeah, thank you very much, Dr. Ceesay. We are more than pleased to have you here. And now that takes us to Honorable Sillah. And welcome to Gunjur TV Online. And also, what an introduction. That is how not to wear a face mask. Okay, introduce yourself anyway for to the viewers.
Thank you very much, Dr. Manjang, Mr. Cham, or Dr. Cham, Barrow. Well, the names are they are on the screen now. But anyway, thank you for having me on this show, this very important show, talking about an issue that is confronting our country. By the way, I am Ousman Sillah. I am the chairperson of the National Assembly Select Committee on Health, Women, Children, Disaster, Humanitarian Relief, and Refugees. This is one of the oversight bodies of the National Assembly that helps in performing oversight on the institutions and processes of the state. So basically, I'm Ousman Sillah. I'm also the National Assembly member for Banjul North, one of the 3 constituencies in the capital city of Banjul, as you all know. So basically, by way of introduction, this is Ousman Sillah.
Yeah, thank you very much. And you can stay there because we're going to start from you. Most of us are outside the country. We are worried about contact tracing, how the COVID patients have been treated, you know, what is the positivity rate. So I'm not sure if I can give them to you one by one, but we will be glad if you can answer these questions for us, you know, to the best of your knowledge. Number one is, what is the current positivity rate in the Gambia? Do you know?
Well, actually, I just don't know, because I don't think there is any work done on that in terms of positivity, because as you know, there is no testing, random testing or organized testing or voluntary testing started in the country. So as far as the rate is concerned, it's really going to be a challenge for me to tell you the figures, because they don't exist. But one can safely say that the number of people who are asymptomatic, who are carrying the virus, are not known, and they are more than what is being revealed in terms of testing. So you can see that a number of people, quite a huge number, might be infected and they don't know, the asymptomatic cases, and they're the ones who are really infecting others. So this is what I can say as far as the rate of infection is concerned, because there are no figures, no statistics exist in that regard.
Yeah, so
as per the population.
Yeah, thank you very much. And another important component of if we ever going to get over this COVID pandemic in the Gambia is contact tracing. What mechanism, are in place, to trace, all the contacts with no proper addressing system or, mobile applications or whatever. How is Gambia, implementing this contact tracing?
Well, as far as contact tracing is concerned, they are engaging contact tracing, but there's a challenge in that, in the sense that as I'm speaking to you, the call line 1025 is experiencing challenges, and when you inquire, they said there are technical challenges. But one thing is also certain from credible sources is that those who are involved in going for sample collection, some of them are infected, others are under quarantine. So you can see that the numbers have reduced. So it affects the response capacity of that unit in terms of the national response, because I think we only have that at the National Public Health Laboratory in Porto. That's the only team, the only outfit that is doing this contact tracing. And it emanates from calls of cases, and they would go to communities, try to identify cases, and then would take them, and then after that they would be engaged in tracing the contacts of the cases, private cases. So as you can see, that's a challenge. So we are really encountering a challenge as far as contact tracing is concerned. Like I said, the numbers are not much in terms of manpower, in terms of capacity, human resource capacity, and then like I told you, they are inflicted. Others are under treatment.
Yeah, so we're going to get that. Mr. Honorable Sillah is in the Gambia. We know things could be really hard. Mr. Sillah, can you hear me? Honorable Sillah, sorry. Hello?
Hello, is that for me?
Yes, can you hear me? Yeah, I'm not done with you. I want you to create a tone for this actually conversation, because we...
you want me to give it a tone?
No, yeah, that's what I'm not done with you. The next question is,
okay.
Is there adequate PPEs, for the frontline workers in the country?
Well, what I can say is what we've been told in terms of information. As a select committee, we have been engaging the executive, and by that I mean the Minister of Health, through our oversight work. We have been inviting them to meetings to update the committee on what is being done. Initially, in terms of the preparedness of the country, we started that way back in March. Early March, the committee started by engaging. Once it was announced by the WHO, a week after, it was announced that the world is facing a public health emergency. By then, it was not even declared a pandemic. The committee convened. We invited the minister and his team, Minister of Health, to come and update us as a committee, as an oversight of the National Assembly, and also through us to the population, because we felt that the population also needed to know what is happening, how the country was prepared then. And then they came and then told us the situation as far as preparedness was concerned. And then we, as a committee, we decided that, well, this is not enough. This is fine that we've got this information, but we also have to go to the ground to see what obtains. But in fact, what we did was we embarked on we embarked on a tour of some key facilities, such as the borders that we felt would be the areas where, by then there was no case registered in the country. So if there was going to be any case, it has to pass through the borders. And these were the Banjul International Airport, the seaport, and then the land borders of Amdalai and Siliti. So we did that. We rolled out as a committee. After that, we also visited the facilities like the Edward Francis Small Teaching Hospital, which should have been the first the referral institution of referral institution, so to speak, to see how ready it was, how prepared it was in terms of handling any outbreak in the country. We did that, and then it was culminated in a meeting with the officials to update them on to inform them what we have seen on the ground and what we felt should be done. In fact, what this did was that it even triggered, because we, as a committee, we started rolling out. In fact, on our second day of rolling out, it triggered the minister and team to go around also to see what is on the ground. So, in fact, they preceded us to the borders, because we started at the hospital and the airport. But before we go to the borders, the minister had gone there the previous day, because it was a number of days that we had decided to roll out. So you can see how we influence the process. So when that was done, we prepared a report and presented the report. And then coincidentally, the day we presented the report was the day that the Gambia discovered its first case.
Yeah,
Gambia
so
reported
in
its
that,
first case. So you can see.
So in that case, the deputies are on top of their games. Again, still you are setting the tone for these discussions. You know, we know COVID can't be treated without oxygen.
Mr. Manjang, come again. It's not getting clear. Come again. Sorry, yeah. I'm not getting you. It's not audible.
Okay, I'm going straight to the point. Do you think we have ventilators in the Gambia? If you have, how many? And also, how? You can hear me? Hello? Okay, he's struggling. When he come back, we'll continue. I will let Karim Dibba to introduce himself to viewers of Gunjur TV online. Mr. Dibba, can you introduce yourself, please?
Yes, thank you very much, Mr. Manjang, and the organizing committee for having me on this panel. Greetings to all my fellow esteemed panelists, to the host of this very important and timely panel discussion, and to each and every one of those who are currently viewing or listening to this simulcast.
Yeah, thank you. Who is Mr. Dibba? People would like to know, our viewers of Gunjur TV online and viewers across other platforms as well.
My full name is Karim Dibba. I am a Gambian by birth, and still I'm a Gambian. I'm resident in the beautiful state of Minnesota, the land of 10,000 lakes in the United States of America. I am also the current president of the Gambian Association here in Minnesota as well. I came to the States maybe a couple of decades ago and graduated back in 2008 with a bachelor's degree. Currently, I'm working in an IT role, and I live with my family here in Minnesota.
Yeah, thank you very much. Honorable Sillah, welcome back again.
Well, it was, we have some technical problems here. You know, Gambia, as you know, the challenges, they are numerous, including
we understand that, and our viewers will all understand that. That's where we all come from. We know the challenges, but this question is so important. If you can help us, do you think, is there any working ventilators in the Gambia, and we have how many? And also the supply of oxygen. We know oxygen is going to be very, very vital, a reliable supply of it. Do you think, can you tell Gambians, yes, we have oxygen in stock and we have a reliable supply chain?
Well, you see, like I said, of course, based on the information we've got from them, from the minister and then the director and officials, is that there is no oxygen at the hospitals, particularly the Edward Francis Small Teaching Hospital, and also the treatment centers. of course, as far as MRC is concerned, for them, I think everything is in place. But also at the level of the sanatorium, the treatment center being managed by government. During our visit, we were told that everything was in place in terms of oxygen, in terms of anything that would require life support is there. As you know, there's no treatment, there's no vaccine, no drug for COVID, but they have a procedure, their protocol that that can treat people who are under their care, like cases. So we were assured that all those things are in place. And recently, you can even see that out of that amount of money given by the World Bank and also Gambia government, they procured some ambulances and equipment and materials. And among those equipment, I was told by the minister, we were informed by the minister that there was some life support machines that, according to them, we have enough. But the challenge also is that we don't only need to have these treatment centers here in the urban area, in the Greater Banjul area, like MRC and sanatorium. I think in fact, that's the recommendation we've given them as a committee in our interactions, that they need to decentralize, upgrade facilities in the countryside, where there'll be no need for any referral of a case for treatment down to the Greater Banjul area. So as far as they have informed us, there is adequate oxygen, PPE as well, because in this consignment, we were told that PPE was also part of it. So they are adequate as far as the information we've been given is concerned. But as you know, as an oversight body, we don't only stop at receiving information. We also verify. That's the essence of oversight. You inform us, we give you the platform to come and inform us, and then we also go on the ground in terms of like just auditing. So we go and verify. We are yet to do that to see what is on the ground, because we were supposed to present a report during this second session of the National Assembly ordinary session, plenary. Unfortunately, the National Assembly wrapped up in an impromptu fashion. We could not have presented our report as a committee, but we had a series of recommendations, which I am not privileged now to share, because it was supposed to be late before the National Assembly by the committee, and then after their adoption, then it is something for public knowledge. But we had a series of recommendations, and then there are challenges. I can confirm there are challenges. Efforts are being made. We applauded the efforts, particularly the efforts of the frontline workers at the level of the hospitals, particularly the level of the treatment centers. The National Red Cross Society is also doing very well, and the other ancillary support, forces, even including the security, they are really doing very well in terms of the response. But challenges still remain. This I can say.
Yeah, thank you very much for laying the foundation for this discussion. I'm going to start with Dr. Mansour Ceesay. You hear the challenges they face as far as contact tracing is concerned. How do you think Gambia can go about this? Because we have a problem. You hear from the Honorable MP. First, the importance of contact tracing, if you can share that with people, and how do you think Gambia can go about it in our settings?
Yeah. So I think the principles in epidemiology are very clear on this, which is that when you have an outbreak of any nature, especially of this magnitude, there are a few principles that need to apply. The first is obviously you need to have a test, a test that actually works and identifies the patient. So you have to have wide availability of that test, and the challenges of the course is to make sure that that's not just available in a few centers, but it should be widely available, and ideally want to make it available to the local regional level, so that everywhere there is a facility to be able to test because it's only when you test that you can then determine what you're going to do. Because if you know who is positive, then you move to the next stage, which is that you then isolate the people who are affected, so that you cut the chain of transmission. And once you do that, the next level is actually you contact trace all the other people who have been in contact with those ones. You contact them and isolate as many as possible. And that's the well-known mantra in epidemiology, and that hasn't really changed. So you'll find that countries that actually have followed on that, they started testing very effectively right from the word go. Have done very well. Germany and Korea, South Korea, have done very well. And countries perhaps like the UK, which were actually quite slow in terms of rolling out those testing facilities, have suffered as a result. So the challenge, I think, it remains a universal truth, which is that we have to be able to test. We have to identify those patients, isolate the ones that are infected, and contact trace as much as possible. I have been hearing stories about the availability of some of those facilities, and I think we're all aware of how challenged the environment is in the Gambia to make sure that those facilities are available. But I think they're doing a very, a sterling job, especially at the level of the people who are actually doing this, because I think it's only by doing this, that's the only way you're going to be able to contain the disease. And parallel to that, another very important thing is actually education, public education, because we need to be able to bring the public, one, to understand that this is a serious disease and it's worthy of the care that it requires. Because if you don't take care, then obviously there's a price to this, and that really is important. So that public education, I think at the very beginning, my understanding was that obviously when this became quite global, the initial impressions, and this unfortunately has been one of the downsides of the modern communication through social media, where you had stories being circulated in social media that people of African origins, or blacks in general, don't tend to get COVID, and even if they get it, it's going to be mild. And unfortunately, that has harmed quite a lot of the initial public health messages that actually were going around, and might have contributed to the increased morbidity and mortality within the Black population across the globe. And what we're now seeing is actually at the beginning, for instance, in the Gambia, there were a lot of skepticisms about whether this disease, A, exists, and B, whether it's actually in the Gambia. And I think public education needs to go a long way to address those issues. Because if you don't bring the public with you, nothing is going to change. Some of the measures that the public would have to do, they have to believe in the messages that is being given to them. So if we say to the public, you need to wear a mask, that has to be mandated and it has to be understood, and people have to come on board with it, and they have to understand why that is the case. And we have to tell them, of course, you need to be able to socially distance. In the Gambian setting, I think that's always going to be a very difficult one. Unlike in some of the more developed countries, social distancing in the context of overcrowded places where people live in very overcrowded places is always going to be a challenge. And some of the facilities like the ferries, it becomes very difficult to socially distance in those places, transportation. But those are the things that people need to come on board. And of course, the importance of making sure that people don't gather together. Some of our traditions are very well entrenched. So you have the naming ceremonies, you have the funeral ceremonies, and a lot of ceremonies will come together.
Mr. Ceesay, I will come back to you. Now, thank you very much for elaborating on that. Now I'm going to bring in Kaddy, who is also right in the center of managing our COVID patients. Kaddy, can you hear me?
Yes.
Yeah. If for the layman, they say there is no cure for COVID, but why people go to health centers or hospital? Can you give us a rundown what it takes to manage a COVID patient?
Assalamu alaikum. I want to say hello to all the panelists, and I want to thank all the frontline personnel and their families for helping us with this COVID fight, and also the sacrifice they are currently doing for our country, and all the frontline workers everywhere in the world. So COVID started in, I think it was in December when we heard about COVID, December of 2019. And in January, we start getting more information when it starts spreading, like a wildfire in Wuhan, China. And since then, there has been a lot of researches that are undergoing to study the COVID virus and see if there are any treatment modalities that we can use to help the patients. But we know the pathophysiology of this disease is a respiratory infection, is a viral RNA that affects the lungs. And then now we have seen in the last 5 to 6 months that COVID infection is not only limited to pulmonary system. It affects different, parts of our organs, like the kidneys. It affects it. It causes some blood clots. We also seen some patients that manifest some neurological symptoms when they do get the COVID infection. So since COVID outbreak, like most viral disease, most of the talking was based on preventative mechanism. How can we prevent the COVID? Because we have to develop a vaccine. It's a virus, but there's nothing like a specific treatment for it. So we talk about the symptoms of COVID before we start talking about the treatment. The symptoms here that we mostly is kind of like respiratory at the beginning, like cough, shortness of breath, sneezing, stuff like that. When we have seen people having headache, very high fevers, some people start having certain symptoms of myalgia, being fatigued, very tired. We have seen all those symptoms. Some start having neurological symptoms, through the late course of the disease. So with the COVID now, we encourage people to, we test people if they have the virus and they are not symptomatic, they can stay home because there is no cure currently for COVID. When people come to the hospital, what we do is called symptomatic management of the symptoms that you are showing. That's what we manage. If you come to the hospital, you're having respiratory symptoms, you can't breathe in the hospital. We try to give you supplemental oxygen to breathe. We start to give you medications that can help you relax your lung muscles for you to be able to have air exchange. Like if you look at the pathophysiology of the COVID virus, it surmounts a big immune response. And then you start having all these inflammatory markers coming out and they attack your lungs, your tissues start damaging, and you develop this thick fluid around the lungs. So it's going to be difficult for you to have an air exchange between the capillaries to the lungs. And then, there's just where air exchange takes place. The blood that is oxygenated goes to the heart and is pumped to the various organs in your body. But if you don't have that good air exchange, you go into a state called hypoxia. That is that you don't have enough oxygen in your bloodstream, you have high amount of CO2, you become hypercapnic also. So you start having more tachycardia, your heart rate goes up, you start breathing fast because your body wants to compensate for this. And all those things can cause what is called tissue damage. You go into lactic acidosis, your tissues can die, your kidneys will shut down because you're not getting enough perfusion to that part of the organ, your livers, all these things happen. So if you come, you need oxygen, we'll put you on supplemental oxygen. And then sometimes people do well with only supplemental oxygen, but sometimes some people do not do well, especially people with underlying comorbidities, like people with COPD, people with asthma, some people who have diabetes and high blood pressure. So in that situation, they need what is called intensive care. So they have to move them from the regular units to the intensive care, where they can put them on a ventilator, because even though they're breathing in air, like I said, there is no proper perfusion going on. So they have to put you on a ventilator to force the air inside your lungs for you to be able to get some air. So usually that's what we do. If you have other symptoms like fever, we treat the fever. And sometimes you can have other underlying infection through the COVID, in addition to COVID viral infection. You can have bacterial pneumonia. If you have bacterial pneumonia, we use antibiotic to treat the bacterial pneumonia. Like I said, COVID affected different, almost I can say now, all organs in the brain, the heart, the liver, everything. So if you go into heart failure, you saw symptoms of heart failure, we'll treat you for heart failure. You know, try to make sure that you don't get fluid overload, get a cardiologist to come see you, especially people who have underlying comorbidities. They are very susceptible to some of these other co-infections that happen in the hospital. If you are diabetic, sometimes you can go into what's called diabetic ketoacidosis because your sugars are very high. There's a lot of electrolyte abnormalities. We have to manage that. So we use those treatments that have already been established for those diseases and try to treat them. If you're very hypertensive, we go into hypertensive crisis. We try to give you medications to bring your high blood pressure down. We do that if you go into kidney failure, we put you on dialysis. We have a consultant like a nephrologist to come, review your case and your medications. That is what we do in the hospital. Sometimes you have neurological symptoms. We make sure that we rule out stroke. And then if we rule out stroke, we rule out other diseases that can cause those symptoms, then we associate those symptoms so that you are having to COVID. So that's what we do, but we do not have any specific treatment modalities to say, this is what is going to cure COVID as of now.
Thank you very much, Kaddy. I think the Honorable Minister is taking a lot of notes because it's not only the issue for the lungs. As the lungs start failing, other organs also start struggling, and eventually they all fail. And recently, the pathophysiology also revealed that there are a lot of involved lot of blood clotting in all the major organs as well. So I hope Honorable MP is taking a lot of notes. Going back to Dr. Fatou Wadda, you work with the most, probably the most vulnerable section of the patient, that's the neonates. How prevalent is COVID among these age group, and how do you manage them?
Okay, so thank you once again for inviting me to this panel. It is much appreciated. I am very glad that I'm amongst a set of epidemiologists and virologists and microbiologists, because it's been several years since I dabbled in any microbiology or virology. As you rightly said, yes, I care for the vulnerable in our society, and those are the preterm infants. So my experience with COVID to date has been to look after the babies of mothers who have been suspected of having COVID. Fortunately for us, I work across two sites. So like I said earlier, we have in our tertiary center, we have a 24-bedded intensive care unit. And in the other unit, we have an 8-bedded special care unit. Fortunately for us, over the past 6 months, we have not had a single baby who tested positive for COVID-19. However, we have had mothers who have tested positive and who have unfortunately ended up in intensive care unit for reasons that Karim has said. Sometimes not necessarily related to COVID-19, but sometimes subsequent to complications on delivery. Now, that's not having had any positive babies, we have had our fair share of challenges, because back in March and April, when the pandemic hit, we didn't have universal testing. The testing that was available in our hospitals took several days to come through. So every mother that Sorry, can you hear me?
Sorry, doctor, your line is breaking up, but I'm not sure if you have another device there open or what, or is only.
No, I don't.
Okay, maybe I will let you drop and come back in again. Maybe that will make it better. But the viewers are complaining they could hardly hear you, and it is breaking. In between, I will call on Mr. Cham, anesthetologist. Mr. Cham, can you hear me? Is Mr. Cham there? Maybe, are you mute?
Now I can hear you.
Okay, we can hear Mr. Cham. I don't know what's happening. I know he's talking, but we can't hear him. Can you hear me?
Yes, I can hear you very well.
Yeah, okay. So I believe you also came across a lot of COVID patients, and your area, anesthesiology, which is very, very important, is central to almost everything in the hospitals. So what actually is your role as far as COVID management is concerned?
Well, thank you very much. And again, I'll double up on what the physician assistant had said earlier. We have to first of all thank the healthcare workers in the front line, especially those that are working in third world countries like the Gambia, because they're working in austere circumstances, environments where they're bereft of resources, and somehow we still expect for them to come up and do the best care for our patients. But as an anesthesia provider, we do come across with COVID patients quite a bit, unfortunately. Not on a daily basis anymore, but frequent enough to be worrisome. And now I work at a trauma center, and what that means is sometimes, generally, as you've already understand, some elective cases were canceled, but most of those are back on the operating room list now. So when patients come with trauma, there may not be enough time to do the COVID test. And what that means is we would have to treat them as though they have COVID if they need emergency operations from, let's say, gunshot wound to car accidents. And it turns out sometimes that those patients do in fact have COVID. So that really tells you that making sure that you do all the infection control preventative measures up front is really important. We now have to be very, very vigilant in terms of how to wear our masks. Most of, if not all of us, have to work with N95 respirators because we automatically have to assume that every single patient that we come across, especially when we go up to the emergency department to help intubate patients, we have to be in a specific sort of attire to prevent us from infecting ourselves and prevent us from being vectors to carry it from one patient to another. In terms of practice, we try to decrease what you called aerosol generating procedures to bare necessity. And what that means is we are the people that are responsible of intubating patients, extubating patients, and we are at it's a respiratory virus, and we are at the head of the bed most of the time. So we are at a higher risk of getting exposed, and by virtue of that, at a higher risk of being vectors to carry it over to other patients. We at our hospital now, we have a dedicated operating room where if a patient is tested positive and needing surgery, we take them to that operating room. If we have an emergency procedure where we are not sure whether the patient may or may not have COVID, whether they're symptomatic or not, we treat them as though they have COVID. So we take them to that dedicated operating room. And in doing that, we make sure that the room is only filled with bare equipment, that, the basic equipment that we need to get the job done. And then you would then have someone like a runner outside the operating room who will grab the equipment as you need it. And the other thing we do is we promptly secure patients' airways, because as we know, the longer time you spend with a patient with COVID or potentially infectious with COVID, the higher the chance of getting infected. And of course, we are constantly, literally on a daily basis, reviewing our infection control protocols. It also turns out that my hospital just happens to be located in a place in the United States where it is serving 4 different states. The states of Washington, it's the only level 1 trauma center in Washington State, in Idaho, in Wyoming, and Alaska. It is essentially covering 25% of United States landmass. So you can see how we tend to get literally every single day urgent cases for emergency surgery. And the more patients you get with unknown status, the more careful you have to be to make sure that you go home safe.
Yeah, thank you very much. So it means in your case, it's like treating everybody guilty until proven innocent, right? Yeah, exactly. That's it. In fact, if I'm anywhere, any kind of hospital, this is what everybody should introduce, including yourself. So in that way, we have to be extra careful. I'm coming back to Dr. Wadda, but Kaddy, yeah, please, can you make this to clear to the viewers that face mask wearing then reduce oxygen level in your blood? Just in 1 minute, then I go back to Dr. Fatou Wadda.
I think that is some misinformation. A lot of people have expanded on that topic. Face mask is not going to stop you from, it make you a little bit, it causes a little bit of discomfort because you don't want to have something covering your mouth and nose. You're not used to it, but it's not decreasing the amount of oxygenation that you are having in your tissues. So that's just a misinformation. Everybody needs to wear masks. I wear masks for duration of 12 hours. And then if I have patients or if in surgery, like when I was doing my rotations, sometimes the surgery can go for 9 hours. You have the mask on. So, and none of us has ever passed out or, been sick from wearing masks. So I think it's a misinformation. We all need to wear masks. We need to take this sickness very seriously.
Thank you very much for that clarification. There is a question here. I can tell I've been wearing masks for like almost more than 20 years now, and I'm fine with it. So, Dr. Fatou Wadda, the lady in charge of the most vulnerable or fragile age group, that is the neonates and also the babies. And is there any indication? Yeah, go ahead, please, where you stop. Can you hear me?
No, go ahead. Are you about to ask a question?
If there is any chances of like mother to child baby transmission, have you come across those kind of incidents?
Okay, right. So I'm not sure where I broke off, and I don't know how much of what I said before you heard, but I'll answer that question first before I go back to what I was talking about. In a nutshell, we don't have clear evidence that there is vertical transmission of COVID-19 at the present moment. There is no evidence to suggest that. There have been studies to suggest that perhaps it may be transmitted via the placenta, but those studies have not been verified. Okay. But like my colleague Ebou Cham said, we treat our mothers who come in to labor to deliver as guilty until proven otherwise. So we actually say anybody that comes into the unit is positive until we get a negative result. So back in March, when testing started, it was extremely difficult to get a result within a few days. Testing used to take at least 2 to 3 days. So mothers and babies would have to be separated after delivery if there was any suspected cases. So basically how we operate in terms of our neonates is that, I don't know if you heard me before, but what I said was that across both sites, so 2 hospitals between 2 sites, fortunately, we have not had a single positive baby. However, because of the nature of their illnesses, these are preterm babies that are born at 24 weeks. will invariably have respiratory symptoms. So until we get the result from the mother, either negative or positive, we treat them as positive. We assume that they are positive until they're proven negative. The way we operate, similarly to what Mr. Cham said, was that we have designated theatres and designated delivery rooms for COVID positive mothers. So if we suspect that she has come in, if a mother comes in to deliver and has symptoms suggestive of COVID, we isolate them. We have a dedicated theatre on both sites that will primarily serve for either COVID positive or COVID suspect mothers. So in those theatres, that's where we do all the cesarean sections that we need to do, or any instrumental deliveries like vacuum or forceps delivery. Obviously, when the babies are born, it takes a lot of equipment, a lot of paraphernalia to transfer them from the delivery area, whether it's the theatre or a delivery room, onto the neonatal unit. And when they reach the neonatal unit, we isolate them. With advanced practices in neonatology, not all our babies require ventilatory support, but some require invasive ventilatory support and some non-invasive. But because they are aerosol producing procedures, we have to don complete personal protective equipment in order to protect ourselves and our families and co-workers. So when the neonates are admitted, depending on what gestation they are, the younger the gestation, more likely that they will need respiratory support. We don't necessarily have to put them on ventilators. We can sometimes manage them without invasive support. And it all depends on how the mother has presented in labor and how sick the baby is when they are born. Obviously, it's challenging because a baby who was supposed to be born at 36 weeks or 37 weeks, who is now born at 24 weeks, is challenging and will be on the neonatal unit for a very long time. But just like my colleague Kaddy has described, these neonates often have other illnesses apart from just the respiratory support, just the respiratory disease. So they have problems with their lungs, they have problems with their gut, they have problems with their heads, their brains, and therefore we continue to nurture them gradually for several weeks until they are fit enough to feed basically on their own. They're able to maintain their temperatures outside incubators, and they're of a weight that is safe enough for them to be discharged home. So the journey for a preterm baby on a neonatal unit is very arduous, both for the neonatal, him or herself, and for the parents. And you can imagine that in these COVID times, though that journey is multiplied a millionfold because of the fact that we are trying to protect ourselves as well as other babies on the unit and the baby himself. So it has been very, very challenging. Recently, we have been able to acquire tests that take less than 48 hours, and therefore we are able to practice what we used to do before and allow mothers on the units to look after their babies rather than separate them for several days while we wait for a test result. So that in itself has eased the stress that newborn mothers have, that staff have, in order to provide care for the babies.
Yeah, thank you very much, Doctor, for those vital.
They are really, really challenging times.
Yeah, thank you very much. I think that will relieve a lot of people that there is no proof that vertical transmission is possible, and also the cares available. I'm not sure the Gambia situation that are going to be very challenging. So I'm going to go to Karim after the first round, where everybody have as much as you can say. The next round of conversation is going to maximum 2 minutes for everybody. So. Mr. Karim Wadda, I believe Karim Dibba is an IT expert, but also he's a COVID survivor. So, you know, he's been there, done it, and got the T-shirt to show for it. So I think this is a good opportunity to tell the viewers that COVID is not a death sentence. So first, I'm going to use this opportunity to still part of your brain that what can we do in the Gambia to use IT to help us in managing COVID generally. And you can proceed to explain to Gambian how it is like to have COVID infection and recovery, you know, both the physical and the mental side. How was it for you?
Thank you very much, Dr. Manjang. To answer the first question, I think, you know, part of what the IT role or the IT team can play in the fight against COVID would be to assist in providing platforms that give users easy accessibility to information, whether this information is about, you know, transmission of or regarding the transmission or symptoms of COVID, or where to find testing centers, or where to find, you know, PPE or things that people can use to prevent themselves or take care of themselves once they have contracted the COVID virus. So I think, you know, the IT role, you know, using, just seeing, you know, what platforms the population use most, and then, you know, coming up with the tools, whether they are apps that would kind of send alerts as to, you know, maybe daily what the number of occurrences or people who contracted COVID are, you know, how many of those people passed, maybe, you know, if need be, also maybe provide break down the information as to maybe the gender, the age group, and, you know, probably what part of the country. So yeah, I would think that, you know, probably as IT experts, we can help make the information access very easy. So I contracted COVID-19, and most importantly, as you mentioned, I survived it. I recovered from it. I would share my story, you know, in this format, where I would, you know, talk about prior to contracting COVID, what were some of the precautions that I took. When I contacted COVID, you know, what were some of my symptoms that I experienced, you know, talk about the testing, support from the family, and probably, you know, kind of the road to recovery. As of today, you know, like I mentioned earlier in my introduction, I'm in the state of Minnesota. You know, we have about 57,000 confirmed COVID cases and a little over 1,600 deaths. At the onset of the pandemic, that is in the very early days, you know, my company where I worked asked that everybody start working from home. So that was an easy transition for us since we were already working from home at least 2 days a week. At the family level, we had to make certain decisions. One of those was that, everyone needed to stay at home. And, I being kind of head of household would be the one that would do most of the outside interactions as to go into the stores to get foods and basic supplies. So during that period, I had a box of gloves in my vehicle, as well as a stack of disposable face masks and hand sanitizers. So my routine prior to exiting out of the vehicle and going into any store was, I would, put on my face mask, either put on gloves or, use hand sanitizer to clean my hands or, put it on my hands before I leave the vehicle and go into a public place. And, when I do the shopping too, when I get home, I would kind of, take off some of my clothes in the garage before I come into the house. Then, once I enter the house, wash my hands. And, depending on how long I've been outside and how maybe, just thinking that I'm exposed, I might take a shower before doing anything else. So towards the end of Ramadan this year, I started not feeling well, just body ache, headache, and runny nose. So my first instinct was like, okay, this might just be the flu. So I started taking Dayquil, cold and flu relief medication, and that made me feel better. After a few days, I woke up not feeling well. I think this was on a Wednesday, and some of my symptoms was, headache again, runny nose, joint and body ache. My joints kind of felt weak. Fever, although I didn't check to see, what my temperature was, and also having dry coughs. And, around, sometime around noon that day too, my wife informed me that she wasn't feeling well. And she had similar symptoms as well, just that hers were severe. She was in more pain than me. And she also mentioned that, she was experiencing shortness of breath. So at this point, what we decided to do was to call the state's COVID-19 response line. And once we did that, we were referred to call the nearest testing facility to where we lived. So when we called, I was asked to, go for a COVID test the following day. But with my wife, since she kind of mentioned that, she was having shortness of breath, they asked that I take her to the emergency room. And those familiar with the US, and this might still be the case, is that, nowadays, when you take someone to the ER, only the person that is affected goes in, none of the family or extra support is allowed to go in. And so she went in and she was, she took the COVID test. We were both told to self-isolate pending the outcome of the results. We got a call from the health team. I think it was for her on Corita Day. We prayed on the Saturday and not the Sunday. So that was when she was told that, she tested positive for COVID. And, part of the questions that they asked, included, they were trying to do some sort of contact tracing to see if we are able to give them information regarding, who we might have come into contact, where, we got infected with COVID. I think, part of it too, once we knew that, now, we are both positive with COVID, the isolation part wasn't easy. Even though, we lived where we have upstairs and downstairs and, there were ample room and restrooms to keep things separate. But, it wasn't an easy walk in the park, being in one place. By then, and still, my mother and nephew are still living with us. They occupied the downstairs, but we kind of all shared the same kitchen. So we would put on masks, even though we are in the home, and we try to stay upstairs as much as possible. But every now and then, we would be in the same space. We just made sure that we did the social distancing of at least 6 feet and kept on the mask even within the house. So with some of the symptoms, the headaches were excruciating for me. At times it seems that, something was trying to crack open my head. Then came the loss of smell. I couldn't smell anything. Then, I would either say loss or change in the taste of things. I think the only thing that I could taste that, were spicy things, like, if it has, hot pepper or regular black pepper, I could taste those. But anything else tasted different in my mouth, especially toothpaste. For some reason, it tasted like motor oil, or, I've never tasted it, but, that's how it, felt whenever I tried to brush my teeth. And then, the body aches too. They were not very bad, just that I easily get fatigued, maybe, getting up, going upstairs or walking around, within the house. I get really tired, just doing the work and not even carrying anything. Part of it too, the coughing, that wasn't bad for me. They were kind of a little bit far in between. But one of the things that, one of the other symptoms too was like my sleep pattern. For the most part, I'll go to bed around 11 and then wake up around 2 to 3 a.m. in the morning. I wouldn't be able to sleep until maybe the early afternoon, around 10, 11, around 12 noon to 1 p.m. Then I'll go to bed and then I'll sleep for maybe 4 or 5 hours and then kind of get up. So that was kind of, the symptoms that I kind of got when I was, when I contracted COVID. I also tend to think that it, at times it tends to play a trick on you, that, in the morning I would feel much better. I think there were, a couple of days where I even, started walking, but I'll walk for about, maybe a couple of hours, and then, then all the symptoms just come back with a rush, and I start hurting, and then, I stopped walking. But I didn't experience any shortness of breath during, my COVID infection. Some of the things that we tried at home and, just putting it out there, whether they worked or not, I couldn't say with any certainty, but, psychologically they helped. Part of that was, saying, boiling water with ginger and lemon, and, we added honey to it. We drank that. That kind of made us felt better. I'm not sure medically whether, it has any impact, but, also, boiling water with ginger, lemon, garlic, and I think turmeric powder, and kind of inhaling that also kind of helped. Although, like I said earlier, I wasn't sure whether it had any impact. We kind of also did observe that drinking the Dayquil cold and flu relieved most of our symptoms, especially when it comes to the body ache, the headache, and then the runny nose. It helped with that. For the duration, for about 3 to 4 hours, all those symptoms would be subsided. But we were advised by the health the county health individuals that we should stop taking those medications, so that, especially with the DayQuil, so that we can know whether we were getting better as the days progressed or not. But
yeah, thank you very much, Mr. Dibba, for that in-depth what happened to you. Sorry, what happened to you and the family. I think the interest here, the actual symptoms, since there is no treatment option, those ones are you just try this and that. So we don't want the since there is no medical evidence that they actually work, we'll stop at the symptoms, but you can hear from the horse mouth. That's how it feels to be a COVID patient. I think Dr. Fatou Wadda, you have a question for the Honorable MP. I will suggest this time questions are not in more than 1 minute, the answers not more than 2 minutes. So Dr. Wadda, you can ask, you are Mido, you can ask the Honorable MP the question you have. And any of you, if you have question for the MP, you are welcome. He's here, he's a policy maker. He's now, anything you want to fire to him, so he will take it to his colleagues at the parliament.
Yes, thank you very much. I would just, I just want to make a quick comment to Karim. Thank you very much for sharing your story. It's a very inspirational story, and it's a story of survival. And I just want to follow up what Dr. Ceesay had said about public information and public knowledge. Karim is a true testament that COVID is not a disease that should be stigmatized. It's not a disease that carries any stigma whatsoever. So if people suspect that they have such symptoms, the advice originally is that you stay at home. But if your symptoms are not manageable at home, you should present to a healthcare facility. And I just wanted to get that message across to our people, to the viewers, or to anybody listening, because I know that probably in the Gambia there might be stigma attached to it, whereas there should not be any. My question to the Honourable MP is, did I hear you right when you said that there was no oxygen at the Royal Victoria Teaching Hospital, the Edward Francis Teaching Hospital?
Well, thank you very much. Well, thank you very much, Dr. Wadda. Well, I do not say that there is no oxygen. I said the information we got from the officials is that there is adequate oxygen at both the Edward Francis Small Teaching Hospital, the main referral, and also the sanatorium, the government-managed treatment center.
Okay, can I just an extension to that question? Is that Dr. Fatou Wadda? Is that you have another question?
I have a question.
Yeah. Okay.
My other question was quite quick. Did you have? Did you say? Do you know whether your healthcare workers have adequate PPE? Because I didn't quite get the answer to that question that Ahmed asked you earlier. Prior to the arrival of the PPE that you said has arrived, are your healthcare workers equipped with PPE?
Well, actually, the information we got also in that regard was that they did have PPE.
Sorry, did you hear me?
In terms of the gowns, what they told us, particularly those that are involved in the. Yes, I very well.
Yeah. He's answering your question. Yeah, thank you.
Did you hear me? Okay. What I'm saying is that the information we got on the ground when we visited the team that normally conducts contact tracing, that goes then sample collection and contact tracing, was that the equipment that they have, the gowns, they are very short because they came from China, and that they would want the committee to impress on the Ministry of Health to get them, ones that are, in terms of size, that fit them in terms of size. So when the consignment came, I inquired from the minister. He said that the ones that are come, the ones that came with the consignment, they are, in terms of size, they really fit in terms of size. But the ones that they had initially were from the Jack Ma Foundation that was donated to the Gambia. But they said because it's from China, perhaps because of the statute of China generally. I'm not stereotyping. It's unfortunate. I'm not stereotyping. Yeah. But according to them, they said it's very short. Yeah, short. When they put it on, it does not go down to the ankle. So, and as you know, COVID, it's always a challenge. But I also wanted to say something. I'm not sure whether you're going to come to that. That this COVID, in the Gambia, would have been or should have been a rallying point. But it is very unfortunate that the actors, they had different purposes, different interests, and different objectives.
Yeah, Honorable, I will give you this platform. You're going to close this, so you going in that you can sum up your problem. Now I'll give chance to Kaddy to fire her question to you.
No problem. Look, she can come.
And if you can do it quickly in 2 minutes.
I will, certainly. I will.
Yeah, sorry. Okay, Kaddy, go ahead, please.
Yeah, what I want to say is more of a comment, because we have seen that countries that are bigger and more powerful than the Gambia, they have made some errors, missteps in addressing this COVID situation. And in part, in the Gambia too has made some missteps. And I think it's not too late to correct them. And the best way we can go ahead in fixing some of this issue is to have the doctors be the lead. You need to have a clinical team. When you have a clinical team in place to make decisions, to help in decision making, you will be more successful. My experience is within the hospital setting, when this COVID came in, we should have like a committee of only doctors to sit down and really talk about this infection, the pathophysiology behind it. How does people get this infection? What they can do when they start seeing cases in the hospital. This COVID has been around since December, January. I think we registered our first case and was in March of 2018. So the moment the COVID came to light, I think in January, we all knew about it. So the doctors should be able to sit down, make a plan for how they are going to manage these COVID patients when they come to the hospital. What resources do they need? What kind of human resources? Like they can make a head count of all the active staff that are working with the Department of State for Health. How many reserve staff do they have? Because you have some trained personnel that are in administration. How can they now include those people into the workforce to become active and provide patient care? Those data should have been available to them, and they can present those data and then to be able to help them purchase their PPEs and reevaluate what kind of plans they need to put forward. And then they can present that plan to the National Assembly to be able to help them with budgeting.
Yeah. Honorable, any?
Well, actually, in fact, her conclusion is, in fact, what I wanted to conclude with. That is the position. For us as a committee, the emphasis from day one was that COVID is a health issue. It is science. It is the health personnel who should take the lead. The Minister of Health and all the technical officials at the level of health should be taking charge. Everything should be supporting them. But unfortunately, that is where we had the wrong. That is where the country had this mistake. Instead of focusing on health, we were focusing on other things, politics, money, things that are quite unrelated to COVID. And it was, in fact, to the surprise of the committee, in fact, even at the level of the National Assembly, instead of the National Assembly focusing on health, there were other interests, other purposes, other objectives, quite unrelated to health. And this is where we had this problem. We could have, of course, the issue of accountability is paramount. I agree that we are talking about resources. Resources had to be committed where they should be. But it should be health. Health should have been the priority. But you see, it was at the National Assembly that this issue of relief came about. It was National Assembly, instead of directing the ministry, directing government to concentrate on health, because this COVID-19 is an opportunity for us to improve our health infrastructure, on our healthcare delivery system. Yeah. This is a one-off opportunity that we could have, utilized to ensure that we have the facilities around the country in a fit-for-purpose state. Trained personnel, highly motivated, highly supported, improve on the services that are everywhere so that we will reduce the referrals. It was really an opportunity. But when we came, they said $500 million was available for commitment to respond to COVID. But even you can see that amount of money, not everything goes for health. Other issues prop up. They're talking about relief. And it was National Assembly members who were doing that. They were the one that forcing government to go and do something.
Mr. Sillah. We will come back to you, but in between, I want Kaddy with microbiology background to advise Gambians how best to wear masks and how to manage it, because most of them are cloth masks, how long they should wear it before they clean it and how they can clean it. If you can do that in 2 minutes, that will be brilliant. I know it's going to be difficult.
Yes, there's a video that I shared, and I think one of the nurses made that video, Miss Nyas, Effie. I mean, if you have the surgical mask, I mean, that is just that's easy because it is color coded. So you will know that the lighter blue, if that's what you have, should be inside. You have to wear that inside, and the blue part should be outside. And also, if you look at the mask, on top there are linings there. You can follow that linings to guide you which side should go inside and which side should go outside. If you are using a cloth mask, just make sure that you wash them. At least they are advising like within 4 hours. And then I'm not sure about the fabric type because there are some debates going around that, depends on the fabric. Sometimes it can be effective, sometimes it won't be effective. So if you are wearing it, make sure it's a little bit thick and make sure you're able to breathe in okay, but take it out after 4 hours. I mean, if you sneeze more inside it and you come in contact with like a fluid and other stuff and they touch the mask, you have to change the mask. And if you wear the mask subconsciously, it should tell you not to touch your face. So you shouldn't be touching your face and trying to adjust the mask every time, especially if you're in public transportation or public places, because your hands will be touching other stuff and you might not be able to have access to sanitizers to disinfect before you start putting on the mask. So.
Yeah, thank you very much. Yeah, you did really, really well in 2 minutes. So I hope that is clear to our viewers and also to us, the panelists. To the panelists, do any of you have any question for the Honorable MP?
I have more of a comment here.
Okay, go ahead.
Honorable Sillah, you did mention that you got reports that the hospital are reporting that they have enough oxygen. I was fortunate enough to actually be at the hospital sometime last year to do what's called a needs-based assessment for some medical mission trip that we're planning on doing next year or the year after. I think we have to be very careful to assure in our efforts to assure the public of whether we have enough of something, especially oxygen, which is very, very important. We cannot guarantee the public that we have enough oxygen. The only way to do that is, in fact, if the hospital has what you call an oxygen concentrator that will be able to entrain room air oxygen on a permanent basis and ensure that there's oxygen in every single intensive care unit, in every single ward. And that is, in fact, not the case. So I'm curious to see what basis they're using to tell you that we have enough oxygen. And the other thing is, there's no oxygen concentrator in Gambia, as far as I know, and correct me if I'm wrong. Just by virtue of that fact, we cannot guarantee that we have enough oxygen because we don't even know the trend of the trajectory of the numbers in terms of who will be infected or who's not going to be infected. It could be 700 today, and it could be 1,000 tomorrow, or 10,000. Hopefully not, but 10, 20,000 in a month's time. And because of that fact, the fact that we don't know should guide us to make sure that when we tell people that we have enough oxygen, we need to be careful how to put it across. But real quick, I also wanted to touch base on our public health surveillance system. I had the opportunity to go to Liberia last year, and I touched base with one Dr. Jerry Brown, who led the fight against Ebola in Liberia. And I took a brief opportunity to ask him about his views on third world country public health surveillance systems. And what he said was three things. One, we have to make sure that the country's borders are secure, because it doesn't matter what public health surveillance system strategy we implement. If for example, through, let's say, contact tracing, collecting data, analyzing data, disseminating it to the people that matter, and sometimes to the public. If the country's borders are not secure, you cannot extrapolate that data for future public health activities. And the reason being, over time, because you have people that are coming through the border in and out, that essentially dilutes the essence of what we're trying to do, to not only stifle the spread of the COVID, but also to come up with a system that we can learn from to make sure that when this happens again, which it will, we will be in a better position to serve our public. And I'm not sure how much we are decentralizing the personal protective equipment to the hard-to-reach areas in the country. Perhaps you can comment to that. And but one big factor that we are facing is trust. And that's the third thing that Dr. Jerry Brown had mentioned to me. What they experienced in Liberia was that there is a rift between the public health officials in the hard-to-reach areas and the public. The public are finding it really difficult to accept the teachings of these, public health officials, because as you understand, the nuances of COVID and the pathophysiology and all these things, the local person may not understand. But if before all this, the system is structured in such
30 more seconds.
Is structured in such a way that there is trust between the public and the health officials. They may not understand the nuances of COVID, but perhaps because of that trust, they are much more likely to buy into whatever it is that you're trying to sell them. Thank you.
Yeah, thank you very much. That's a brilliant commentary. This is a perfect opportunity to actually help our country directly towards Mr. Honorable Sillah. Mr. Sillah is the chairman of the Health Oversight Committee of the Parliament. So he is in a very, very vantage point to take these comments and advices on, on board and take it to his colleagues at the Parliament. Any other comment? But before that, I'm going to use the opportunity of my chair to ask Honorable Sillah. We understand there is a water problem at the Francis Small Teaching Hospital. If nowadays goes, there is no water, running water in the middle of pandemic. And this is our only major referral hospital. Are you people aware of this? And if you are, what are you doing about it?
Well, thank you very much, Dr. Manjang. We are not aware of everything that happens, but I know the challenges abound. There are so many challenges. In fact, as a committee, we are trying to engage the officials at the personal level. But as you know, the committee is trying to engage them again. I know there are so many challenges, like I said, in the sector. So many things are supposed to be fixed that are not yet fixed. There is need for coordination. In fact, the position is that government needs to have a policy on testing, a policy on isolation. There is, of course, in terms of isolation, a policy on tracing and a policy on treatment. All these things need to be in place in terms of policy frameworks. In terms of operations also, there are challenges. I think you hear about the motivation of the staff, those at the front line. Those are all issues that need to be addressed. How are they going to be, acknowledged in terms of motivation, the different levels, those who are high risk, medium risk, low risk, issues like that. These are all challenges at the level of the services that are being given in response to COVID. We are quite okay with the challenges, and we are really out to engage them. As you know, presently there is a political vacuum. The minister is presently on the quarantine. We also ought to know who is there in his absence to be directing things, because we cannot be operating in a vacuum. So these are all things that, and as you know, unfortunately, the Parliament now is on recess. We are on vacation for the whole month of August. But this does not preclude our engagement, our continued engagement with the authorities. And we're doing that at various levels. We're going to look into this issue because it's not only Edward Francis, but it's the community in general. because you're talking about sanitation, is cleanliness. COVID is one of the measures to address it is cleanliness, and you need water. And then the communities, there are communities that do not have water. So we need it at the level of facilities, we need at the level of the community. But to conclude, I think, like I said, all the stakeholders have a role to play. The executive at the level of the Ministry of Health, Ministry of Finance, the presidency, they need to be committing resources, they need to be committed to this. And then you have National Assembly also has a role to play. But like I said, we elbowed ourselves at some point. I could not have time to elaborate on that. That when we should have really been in charge, the National Assembly decided to shy away from responsibility, abdicating responsibility. I must admit this.
Thank you,
at the level of the community.
If you can make them sort of like 2 minutes, that would be great.
At the level of the community, we're talking about face masks. Communities also need to clearly adhere to the precautions of WHO that are being amplified by the Ministry of Health in terms of face masks, in terms of hand hygiene, public gatherings, avoiding burials, funerals, gatherings in general. So we really need to own up to our responsibilities as a nation, and this is something that should unite us. No partisan issues, no personal issues. Like I said, initially there's the concern regarding accountability. No one should use this as an opportunity to enrich yourself. As a committee, I'm telling you, we are ready. We are going to engage them to ensure that there's accountability. There's always time for us to engage to ensure that there's accountability. But now the issue is, how do we concentrate on COVID? Give the health personnel the opportunity to take the lead and give them all the support in terms of legislation, in terms of resources. In fact, you said we are not policy makers, we are lawmakers. We approve resources and we make the laws. So how do we support the health system, healthcare delivery system, so that, like I said initially, that we will emerge out of this with a robust, efficient, effective, resilient, affordable, accessible healthcare delivery system. That is what we are expecting.
Thank you very much. That is very reassuring. Where is Mr. Ceesay? Dr. Ceesay is here. He drops. Okay. Mr. Dibba, do you have any comment or question for the Honorable?
Yes, I do have a question and maybe kind of a comment for the Honorable Mr. Sillah. From your deliberation, it seems that what in essence you are telling us is that the parliamentary committee that you are part of, that's looking at the pandemic and the health crisis that we are in, seems to me that it's more of an oversight committee where you look, you review, you come up with recommendations. My question is, does the committee or the National Assembly as a whole has any way of enforcing whatever recommendations you come up with? Because at the end of the day, it's all good to have recommendations that would work, but if as an oversight committee, there isn't any way that you can oversee the actual implementation or make sure that those recommendations are implemented, I think, for lack of a, better work, it would just kind of be a waste of time. And the fact that, at this very moment, it's very critical that, as Gambians, whether it's the legislative or the presidency or ordinary citizens, we all need to get our acts together to make sure that, we fight COVID. What would be the impact of the National Assembly reconvening as soon as possible to maybe help address some of the issues, whether it's, making sure that, the budgeting of the COVID funds are, sent to the right locations? Because from here, we hear, there's a lot of money being given out, but if nurses or if there's
20 seconds you have.
Yeah, if there's a shortage of PPP equipment or PPE equipment, then, one begs to ask, where is all that money? We cannot wait until COVID kills so many people and then try to do assessment by them.
No, I agree. You're quite right, Dr. Dibba. Of course, the role of oversight committees basically is to do fact-finding and then make recommendations to the plenary. It is the plenary that adopts those recommendations, and after recommendations, they have to be implemented. The committee and then the National Assembly as a whole have this authority to ensure the implementation of recommendations. We can do it. As you are asking, of course, nothing stops Parliament from reconvening. But as you know, we also have to be very mindful of gathering people. We can do it virtually, as we are doing virtual sessions. Nothing stops the Parliament from doing that. But it depends on the exigency. If there is need for us to reconvene, of course, we wouldn't hesitate to encourage that, to even recommend for the National Assembly to reconvene. But like I said, it all depends on what is on the ground in terms of the services, in terms of healthcare workers, what they're advising us to do. I agree with you that we cannot wait until COVID had killed people that we start, looking for accountability. It is now. It is something that will be ongoing, and in fact, that's the role of the committees. And as I said, the committee is not sitting on its laurels. We are very keen. We are very, 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 very much concerned, and we are devising means of ensuring that there is accountability along the way. So that at least any need for recommendation, we recommend to the plenary.
Thank you very much. Let's keep it 2 minutes. Just a small reminder. I'm coming to you, Mr. Ceesay. But Honorable MP, our Commander-in-Chief is missing in action. I think he's also in quarantine. And you just admitted here that your people are in vacation. And the health minister is also under quarantine. So who is in charge at this present time of managing this COVID?
Well, for us, we have different roles. The executive has its role to play. The National Assembly has its role to play. Of course, we are, like I said, we are on vacation, we are on recess, but this does not stop us from operating. If there is any exigency, any need for us to prorogue Parliament, we will hesitate. I myself, as an elected representative, to recommend to my colleagues that there is need for us to prorogue Parliament to address an urgent issue that needs urgent action, urgent attention. So as far as the Parliament is concerned, we are always ready.
Okay, Mr. Ceesay, any comment or question for Honorable MP? Because this is a good opportunity. All of you have experience how to manage this in the most probably the best possible environment. So this is a good opportunity to impress on our Honorable MP that he can take this information to his colleagues, even though they are right now on holiday, which I find it difficult to understand because Gambia is in a state of real emergency. Yeah, go on, Mr. Ceesay.
Yeah, so thank you very much. And I have to say apologies that the last few minutes, actually last half an hour, my internet connection is such that I couldn't hear much of what people are saying. But I think to keep it simple, the key thing for Mr. Sillah and the legislature and the everyone who is on the ground, we have to keep this simple. The simple rule in medicine is actually that prevention is actually better than cure, especially where there is no cure. Your best tool and only tool practically is actually to prevent this disease. So I think that the massive educational campaigns that needs to be stepped up to make sure that ordinary Gambians, because they are the ones who actually need to be educated, they need to be on board to be able to help prevent this disease from spreading from one person to the other. And that has to be done intensively at all levels, and it has to be seen to be done. All these mass gatherings and things are creating a problem, and they are a focus for spread of the infection. So that has to be done at all levels: radio, television, small group meetings, and all the rest of it. And I think that, you make the valid point, Mr. Chair, that, this is a real emergency. I don't think, research should actually be part of this. And you don't have to be in the National Assembly to do your job. You can do it remotely quite often. But I think a massive educational campaign to get the ordinary Gambians educated and on board and look at all the issues that actually arise, to prevent mass gatherings would be the only hope for slowing down and preventing a lot of people getting this infection.
Thank you very
Mr. Manjang, I think you are muted. We can't hear you.
Yeah, muted.
Yes, I remember.
Okay.
Yeah, I was going to say, so we can all mute if you are not talking. May I ask the panelists, is any of you ready to go to the Gambia now and offer help? Or would any of you be ready to offer help remotely, like through online training and directly to the hospital also? Anyone?
I want to comment on this, Mr. Manjang.
Okay.
I think what
Go
the
ahead.
Gambia government need to realize that they have a lot of talented citizens outside the country. And I do believe when the government came in 2016, one of the things they said was to establish kind of like a think tank committee where they can have Gambians from diaspora put their information and their resumes for them to be able to work or help if they want to. So what I'm suggesting is that the Ministry of Health or other departments or other ministries, they can work with an organization, example, the one day Dibba started, like the job consulting group, to establish an online portal where Gambians in the diaspora can put their resumes, their qualifications. And the consulting group can try to, it's gonna be like a volunteer group. Then the consulting group can try to match skills that are needed and people, that are available to volunteer in those areas. There are a lot of things that can be done remotely. And I've seen an organization that participated in an online training for the psychosocial counselors that are manning the TRRC Victim Center. And that's called GAMSA. They did online training for those people, training of trainers. And they did a great job doing that. So Gambians can come online and volunteer. Say, for example, I want to volunteer 8 hours of my time to do like a CME, run a CME, like a continuous medical education program, or I want to teach a course. We should be able to do it virtually. So these are things that they can do. And then you have some Gambian doctors here who are radiologists. In my hospital, in the middle of the night, we don't have radiologists in-house. We use people who are in Syria, in other parts of the world, to read our images. So Gambians can come and volunteer. Say, for example, a radiologist here can say, well, I want to volunteer 8 hours every week, to help my colleagues. They can take images like CT scans, X-ray, and then the person can come online, access those information in a secure online area and review those images and give report. Those are things people can do. So there are a lot of organizations here with talented people, but they need to organize this thing, have an online portal where people can go like a volunteer site, make it transparent and have an independent group like the Jabades group to recruit people for them to volunteer their hours. You don't physically have to be in the Gambia to render support. You can render support anywhere you are. My child participated in OT program before, like occupational therapy. We have to go to the office. But with the COVID, we are staying home doing occupational therapy virtually. So people who have stroke, people who have other symptoms, and they need like PT, OT, those are things now they can offer online. So this is something that they can look into.
Yeah, thank you very much, Kaddy, for that brilliant comment. And I believe the Honorable MP is taking notes. And I believe Dr. Fatou Wadda also want to comment about the question I just read.
Yeah, really a follow-up to what Dr. Ceesay said before I just answered to what Karim has said also. I think the message of social or physical distancing has got to be reiterated. So much emphasis needs to be on that. That concept is alien to us. It's against our religious and traditional norms, but we all know that it works. And therefore, we have to get that message across. We have to stop this unnecessary social gathering.
I can't quite hear Dr. Fatou Wadda.
Can you hear me? Can you hear me?
Yes, I can hear you.
Okay, so we have to try and get the message across to the public that social and physical distancing works, and that it is imperative that we try as much as possible to limit social gatherings. These are unprecedented times. They're not normal times. So it worries me greatly that we're going about as if they are normal times. And I think the message should be taken across to the people that we need to disband this. Just before we came on, just before we started, I saw a message from the Catholic bishop that all mass gatherings in church was to be discontinued until further notice. We know that that works, and therefore we have to let our people know, yes, it is contrary to what we're used to, but it's a good move. Secondly, in addition to what, in answer to what Ahmed has asked about people volunteering, I agree with Kaddy that there are a lot of online programs that we can be involved in. There is already a website or a data collection of people in the diaspora. I have a link to one as well that I could share with you if you're so interested. And just quickly, I just wanted to say about PPE. I think that it's vital that we get adequate PPE. There will never be enough PPE because we all know as healthcare professionals that it runs out. And if we are not going to be able to protect ourselves, how can we protect our patients and our families? I have recently been in contact with someone at the Ministry of Health to see if we can procure some PPE, and I will follow up on that, because I think in a pandemic, there is absolutely no emergency. If we cannot protect ourselves, you cannot protect your patients and other healthcare workers. So I think it's imperative that we get the appropriate and adequate PPE for our healthcare workers back then. I mean, we're all vulnerable, but as healthcare workers, we're even more vulnerable. And I feel for my colleagues that are in the Gambia and in the health centers and in the hospitals. That was my contribution.
Yeah. Thank you very much, Doctor, for that insightful comment. I will give what I normally do in Gunyuk TV Online. We give our viewers the platform to also express their opinion. But maybe today I have so many panelists, I forget about our viewers. But I'm going to Honorable Minister, MP, listening to one Idrami. He said, is the situation not bad enough to have parliamentary sitting every day? That's one of his questions. Then there's a comment. He said, the Gambia is a sad nation. You know, the advice I'm hearing from the government and experts, what I have been telling people many months ago. I am not an expert, but I saw this coming. Are you people incompetent? This is sad. Parliament's as bad as the cabinet. You know, and the same Ed says, definitely the people in the diaspora want to help always. But the government do not listen, and yet they accuse diasporans that we just want job, and if we don't have it, we start criticizing. And finally, he said, UK, Pakistani form an online group, the Zoom, to help support doctors in Pakistan. You know, the Gambia government need to tap the talents in the diaspora and to help these nations. You know, create platforms and invite diasporan experts to volunteer. But the government should be open to criticism and ready to change and stop politicizing the pandemic. That's a little bit more, but it's a concern Gambian, just like any of us. Honorable MP, give you the opportunity to respond to those strong comments from one of our viewers. You think Gambia is a sad state?
Thank you very much, Dr. Manjang. Yes, I would agree that there is nothing wrong with Parliament meeting every day, but one must also understand what should Parliament meet for. You know, you have to understand how Parliament operates, because you have plenary, everybody comes, then we have issues on the order paper to discuss, to debate on, to pass. And you also have committees, oversight committees, inviting officials. I think what people should be asking is for those oversight committees to start engaging. I think that is where the real work is. Once we know, like for instance, we can ask the minister, for the past month or this coming month, how many resources do you need? What do you need those resources for? I mean, the Minister of Health. Can you tell us? They come and share with the Select Committee on Health, and from there, they also account for us what they have received the previous month, where they have it, and then for us to determine whether it was really put where it is meant to respond to COVID-19. I think these are the approaches that one can take. But for the whole Parliament to come back to do what? Those are the questions. Nothing is wrong with Parliament coming. But like I said, there must be a reason, and this is how Parliament operate. I think what should happen now is for the parliamentary committees to be engaged, to be inquiring, for in this case, health. The Parliamentary Committee on Health, nothing is wrong with it, from requesting from the ministry to show this coming month of August, what do they need? What type of resources do they need? Where do they want to put it? And then what is going to be the impact in terms of responding to COVID-19? I think this is an approach that one can take. And then we can do this with safe distancing, physical distancing. We can do it in a virtual form. It's just the internet is here. You can sit in your house, or we can go to a parliamentary committees, make sure that there is physical distancing. You just need to avoid the crowd. I think there's nothing wrong with that. And then, like the other point, we should. I agree with one of the comments that we should not be politicizing this. Like I said, this should be a rallying point. This is something that affects everybody. COVID is an enemy to everybody. It's an adversary to every person living in the Gambia. So it's the common enemy. We must unite around it. We must unite against it, regardless of the parties we support, regardless of where we come from, whether we support what is in place in terms of, administration, or whether we oppose it. That is immaterial. That's important. That's our right to support and not to oppose. But this is not an issue to support government or an issue to oppose government. This is an issue to support the Gambian people, including yourself and the people that you represent, your constituents. So how do we act in concert? I think that's the concern now. How does the National Assembly and the executive come together to ensure that resources are in place, are available to address COVID-19, adequately? And then civil society, non-state actors, what role can they play to support the process? Like what we are doing, I really applaud this initiative. This is what Gambians should be doing. This is what we should have been doing since in the beginning. Like I said, I agree with you that Gambia does not lack potential. It's just a question of harnessing the potential. We have human resource potential, we have expertise, both in the Gambia and the diaspora. It's just a question of leadership, trying to identify this potential, harnessing them.
Mr. Sillah, you 2 seconds. I think that's a brilliant questions. Now we go to the other side. We are only talking about pandemics, but pandemic doesn't mean other illness take a break or they are in recess. As if, we still have people in the Gambia with other debilitating medical conditions like hepatitis, like hypertension, like those are recovering from stroke, and also those who need daily dialysis or weekly whatever. I'm going to start with Dr. Fatou Wadda. What do you think people on the ground, managing our health need to do to make sure that these people are not forgotten? And also, it's rainy season in the Gambia. We know malaria also spikes during this time of the year, and other intracranial illnesses as well. Your microphone is mute.
Thank you.
Hello?
Yeah. Can you hear me?
Yes.
Hello? Yeah. So thank you very much.
Hello.
That is a very important issue because so much attention is focused on COVID at the moment that we are at danger of losing sight of other ailments. Like you said, there are still people out there who are diabetic, people out there who are hypertensive, and who have asthma. My message to people would be, if there was ever a time to be more vigilant about your health, this is the time. So if you have existing conditions, please, if you are diabetic, continue to take your insulin or your oral hypoglycemic medication. If you are hypertensive, take your blood pressure tablets. If you have asthma, use your inhalers judiciously. And part of the public health message should be that, please do not forget, people who have pre-existing conditions should seek help if they need them. They shouldn't be afraid to come to hospital if they need to go to hospital or if they need to go to a health facility, because that is what happened here in the UK. At the height of the pandemic, there was a very marked reduction in A&E attendances. People also have cancer out there. So if women do what they do regularly, if they examine regularly their breasts for lumps, they should continue to do that, because when COVID is over and done with, we will still have these ailments. So I think the public message should be, please, if you have an ailment, don't let COVID be a deterrent for you to seek medical help. And one more thing I would like to quickly say, as a pediatrician by nature, I have to say, please, children should not be forgotten with routine immunizations. This is a point at which we will easily forget to routinely immunize our children. So if you have children and grandchildren out there, please, I implore you, encourage their parents to take them to their health facilities to have their routine immunizations. Because at the end of this, COVID will end eventually. I can't tell you when it will end. No one can tell you when it will end. But we will still have diphtheria, tetanus, pertussis. We will still have mumps, measles, and rubella. So please, in addition to all the other adult ailments, please get your children immunized. Thank you.
Yeah, thank you very much, Doctor. Mr. Cham, you don't speak for a while.
No, it's totally fine. I'm enjoying the forum, so it's all good.
She's calling people to come and have their this, but in a resources limited setting like ours, what do you think they can do to make sure that these other category of illness are not forgotten, or they are properly, fairly catered for?
Thank you. I think Dr. Wadda had mentioned most of that. We all know that you are at a higher risk for infecting. Well, once you're positive for COVID, you have a higher risk of having severe symptoms if you have comorbid conditions like CKDs or hypertension or diabetes, some malignancies and some chronic liver conditions. So because of COVID, we should actually be more eager to seek for medical help, because if we don't, COVID now then puts us at a much higher risk of suffering from more debilitating consequences, potentially death. So that's established. But you've mentioned a little bit about the fact that we are in a resource scarce environment. The only thing I'm going to say about that actually goes to the public. Yes, the government is absolutely responsible to make sure that there's enough masks at the hospital setting. And it would be a privilege if the government is able to provide masks for the general population, every single one of us. You have to remember, we are only 2.4 million people. And the public needs to understand that we are the government. We cannot just say that the government is responsible for every aspect of our daily bread. The government is not going to come and give you lunch, breakfast, and dinner. So we have to take individual responsibility. We have to do away with what I call the, how do I say it, Yala Bahna syndrome, where we play invincible every single time. We think it's a hoax. We refuse to let the regulations dent our convenience to the point that you don't wear masks outside. We know it's a respiratory disease. the single most, if there's one thing that we all have to do to drastically drive down the transmission from one person to the next, is wearing masks. Now, we understand that not everyone is going to wear surgical masks out in public. It's best if you have them. It's better to have even N95 masks. But we are saying that even cloth masks help decrease the spread of the infection. I think we, in literally 48 hours, every single person in Gambia should be able to have a cloth mask. Real quick, I was just talking to a friend of mine after the Tobaski to just greet them. And he sent me a picture with his wife. And it makes me laugh because what happens is he's wearing a big gown with the Neti Abdu and everything without a mask. And he's saying that the government is not providing the public with masks. I laughed because I'm thinking in my head from a public health standpoint, in a resource scarce community or country, his Waramba, you can literally create 30 masks out of the Waramba. And if we start thinking along those lines, in as ridiculous as it may sound, we should be able to provide a mask for every single Gambian. That's even more important because we are in an environment, as Dr. Ceesay earlier mentioned, where social distancing is difficult. We would like for it to be done, but based on our social dealings, it's really hard to follow these rules. And our best bet is prevention. And within that context, our best bet is to wear masks. And again, within that context, our best bet is to make sure that we take individual responsibilities. Yeah,
thank you very much, Mr. Cham. That's brilliant, insightful. These rounds, anybody can speak in any local language you are comfortable with. Our colleague Kaddy is about to take leave for us, but before that, so 2 minutes maximum when we talk. But for Kaddy, I'll give her extra 2 minutes because this might be her last opportunity. Kaddy, in any language local language you are comfortable with. Kurandol bijele mi nim COVID man clear. And sama kono ngalo no fana is no eka burden because malaria kanale order kono problem ol kanale. So mine se keno puru kaje ko wol COVID laning spike nya kana attention or draw from them.
Yeah, Baraka, Mr. Manjang. Yo bari Gambia no coming kachada tanyame be COVID kachala bari mol fanan salon ko COVID ko la kurandol bi jele mene alon ka mol muta dol fanan bi je kurang men bi dol la chronic tele comme high blood pressure nyol sukul kurang ka me diabetes dol fanan bi je stroke stonu ndu ka borol tale ka doctorol follow chronically o kono fanan malaria bi jela siata Gambia mol ka malaria soto ndumbe sama la kono malaria season siata kono bayol siata and other respiratory sasal fanan siata comme pneumonia nyol ten mben kamol muta so nuo sasali e muta ibe suwo kono kana fo COVID lebe keri yeto sirin suwo kono nyata tala le ye yita doctorol je ye fanjara wo important tala because ni data si o sasal bele mol mana kunno COVID nata law kan abe kole ala le asi COVID fang si patandi no so ko meni ala ko chronic sasal bele comme sukur courant ka me diabetes and high blood pressure mol ya jela nyin courant COVID akal dum mol la bakal me an ko nyin chronic sasal bele so nuol bele nyanta trale le diabetes manage nila insulin banta wala diabetes medicine banta nyanta trale for the doctorol je saje medication or soto isaje diabetes kana worse because imalla fi COVID muta nyin diabetes fanam bela man control o batna la ko COVID be batandi la bakel so nte fana nyen lafta men adla je Gambia government fana ni order do kulalo private clinical aning private hospital ni nyomoy because santa important le hospital clinics to me alon ko kabe kala COVID each region like a COVID clinic so ni ila personnel fana wala na is very important the account of ila personnel because Gambia doctoral man siaje no sol man siaje bar ni at least a good auditing ke alon ko doctor nangam karre molbul nurse nangam karre molbul yo belo andi nyanta alon na fana doctoral men be bulu dol ka do ko ke public be pare ka do ko ke private institutional so santa bari ni COVID pandemic emergency be caring and they need 24/7 multra do ko because of more cases binal as time goes on more babari nko trend le bayndi inyanta o doctoral men ka do ko private clinic ye restrict number of hours they come do ko private clinic because near 12 hours do ko or 10 hours do ko within public system you quite another 8 hours do ko private system it enough time to la recover a rest in amburna back into the system and you nyanta tara on call so nyanta le good account of la human resource la personnel la frontline ye long and no pare ni private clinic ko ñom moy maybe government safako private clinic the subvention dealer from this COVID money. Ko nimol sasate natike whether insurance to insurance to whether they have the ability to pay or not. Lafta for example, each patient based on the complexity sasa men bela ye determine ko nimmo nata malaria treatment of nakai. Maybe for example, mbe $5 dealer propose. You can build the government through that. Nin do not a diabetes management na ya admit ge insulin drip kai for example atara into DKA ye lab dema run be $20 la for that visit. So isaje your announcement ke nimme sasa ya manke COVID itata wala pitano isi access to noje ndum saje of la pitano me alon ko na ñun major hospital ñanta mol admit la je consultant wal kanaje wol si COVID patient tol ma koy no. So I think that is something in ñanta jubele in private clinic ko le do ko ke and in the private lab sol fane ni do ko ke because ni ko ngama nun sodo I don't know how true is this kon na lab men ka testing ke almost 70% baby quarantine. So no 70% be quarantine they gonna have what is called backlog. And no coming out from in COVID sasa and sasa be ni nada. Objectively nyanta ka patient to assist kalon ko mune ba. Nim person ko ko kandimi kono kandimi. Sasa jamala ka kundi moni kuna dimoke. But as a doctor nyanta ka test your run to determine fanyin sasa le bala fanyin sasa ta. So test your local dinner to get an objective information. So nini lab sol coordinator coming jabot lab ñol binte ba je wala bijenu ngabra lab dol fanan bijele ini e ñomoy ko même manke COVID test but malaria test them diabetes blood sugar test them other stuff all year round this is how much we're going to pay you. So you get transparent coming they don't need to have a third party to go into negotiation between government and the other kenko government yela kenko everybody have to sacrifice to put something towards this COVID and in the general population, proving COVID sa fight no alongside na infection dole kana control ka. So ntenga nyini msito kamemfo.
Yeah, thank you very much, Dr. Kaddy Barrow. Kaddy had been immense. In fact, I know her through COVID. So, you know, as the Honorable MP said, this should be a rallying call. I made a lot of friends through because of COVID. You know, I discovered Gambian doctors, you know, lab personnel in the diaspora. So diaspora has always been willing to help, to lend hands. So it's the time of the onus is on the Gambian government to extend, you know, that you know, to open those to the diaspora so that they can contribute and help. I will go to Karim Dibba. You've been quiet for a while, and sorry about that. You know where we are. We have other illnesses, and also we have COVID. But now COVID is taking the center stage. You know, what do you think or people can do to make sure that other illnesses are not disregarded? Thank you.
You know, I think part of the issue here is that, you know, every COVID seems to affect every other, you know, health provider system, you know, whether it's a hospital or whether it's a clinic, until such time that, you know, I think some of the panelists alluded to, until such time that we are able to designate certain clinics just for COVID, and then, you know, certain clinics or hospitals just for the regular medical procedures, then it becomes difficult, because then, you know, some people with COVID, some people with other illnesses and not necessarily COVID might be scared to, you know, venture out, maybe due to the nature of their illness. If somebody maybe has a respiratory infection or disease, you know, you want them to go out to take care of themselves, you know, they will be scared that they might contract COVID. So I think it would be paramount that, you know, certain hospitals are designated for COVID treatment and, or, you know, testing, and others for non-COVID patients. And that way, you know, that might, you know, encourage other people to go out and, you know, get the necessary help. Away from that a little bit, what I wanted to say is, you know, I understand that we are saying we don't need to politicize the response to COVID, but I'm thinking, you know, we can politicize it in a different way. You know, not everybody listens to any one person. if all the political leaders, they don't need to come out together as one group and address the nation, but if each of the political leaders in the Gambia kind of asks their supporters to start wearing masks, to start social distancing, I believe that would have more impact than it coming from the central government, if my knowledge of Gambian is anything to go by. So I think we need to politicize it, in such that, the message coming out of our politicians is uniform in the sense that, social distance, stop going to mass gatherings, put on masks wherever you go out. I think that would help us, in the long run, and that in the short term, it might even, shorten or flatten the curve, as they say it here. And, quickly to the database that, Madam Barrow was mentioning, we did have that database I was part of the DCC, I think it was the Diaspora Command Center, and we did have a database of Gambians with different skills, with different, professions that were, willing to work with the government or even come back. But the database was never utilized by the government. So I think part of what I would ask Honorable Sillah would be to help, make use of that database, or if any other database comes up with professionals in the diaspora, to get those people or connect them to the right departments and make sure that there are mechanisms of making sure that people that want to help are given the chance and opportunity to come back to the Gambia and contribute their quota.
Yeah, thank you very much, Mr. Chairman. Just to tell you, sorry, we keep you here for like 2.5 hours. I know very soon Mr. Cham and Mr. Ceesay will be taking leave of us. But overall, in 10 minutes, we should finish this program. Coming to Dr. Ceesay, as somebody with some epidemiological background, you can speak and say any language, and I will prefer you all speak in the language you are comfortable with in this final part of this conversation. We hear patients jumping quarantine or treatment centers. What's the implication of this to our management of this COVID-19? You are mute. You are mute. Your microphone is mute. Yeah.
Okay. Abarka bake Dr. Manjang nim panel molbe men yalanko ya kumol nyimfo ning mosim mako ke Gambia la ye ka ye fanne mako e kadu mbe batawol to na family nyala na bolat ni mo fenne te me yalanko e ka men albala wal beladin nyakanten saintan momo mang ata ko me yalanko albala be arin nyakanten it's a bit mistake balakil adum fenna munyinti ninga nata bu kamo karide coming ke balam bang dindin bang momo be banko kan momo be science abu dunya din crowding bu kamo kare so ning atra moy infection o soto me infection o soto atla duty movement walen aya fon tankande ka modol fana tankande ani modol kana men yalan kay ma infection so ni kana kata nyol hanni la fita katala la fa si bay ko al kana katan ne ko ntan infection so minu fana ma infection so wol fani yalan ko man yana katala wala ko ni katala wala be infection spread la so e kam for the men yalan ko e katara quarantine e ka quarantine kata din kral to ten ko ka ko dole di mol la bang ko communique e kay fan e ka banko le tor e kay fan ne tor ka ni atra to nyabe dan woli infection ni soto e kata dinka men de infection spread wol nyama adu infection ka tawale nyama ay bodo to ay ta do to so mobile duty momenti wala nyalam ko niya soto wala ya sister ko ya soto ye ifan tankandi ye banko mol tankandi o bumbela fennete mi alon ko nyanda menkel andi be mur la fonko nyimfana kan comme Dr. Wadda ya fo mo ko ton fana ya fo na ado momente wala nyinte ko ngasi ngata salola ngasi ngata kulyola ngata namol fata ngata bade be mu ko le mi alan ko ngasi be mbulol di la nyola be nakin ni nyola nyin koy men samana wala fonsi wolu jube tron katu niyaji be hanata menu muslimot ila muslimiyat kamino la makal madina sa wa haramaini ni be salle kajale ka sal nyamen to ani ka sal nyamen sa man amang kinya ñinan hijo ngajele ka ñamen ñina hijo anin serum ko hijo akil ñama man ko ñam ñinan taman ko ñam so mobe ñante hakil tulale ko ni be hakil tu ibe fenne sabule famma ibe fenne sabule la banku molma men yawan ko amam beta so be ñanta hakil tulale na ado moment de fansing hakil tu dro nimbe katla ñola nga mas dung ad ni nga akal be trading krato si jamfano ñola ni atan si wono bitum min beyo beke di ngo beke me fanna de mal nga banko be de ma hatu ñi mu fennati mi alan ko kuran amang man joran surala folo mi alan ka be jararo kel so jararo mente wala hakil toti ye hakil tu fonto ye hakil tu la dimbayatu ye hakil tu mo bete mi alan ko be dal tengola sembe mo folo mbadi ngole.
Yeah, thank you very, very much, Dr. Ceesay. You've been immense, brilliant and insightful. Dr. Wadda, final comments in any language you feel like. I prefer you speak the local language, might be Wolof or Fula or whatever.
Wabana, okay, and now what you all of con.
Okay.
Man, assalamu alaikum, maa ngi nuyu mbooloo mi yëpp li ma ñaan suma mbokk yi rek mooy pour wax leen ne covid bi lu am la mu ci àddina bi comme li Ebou Cham wax wax naa ne léegi ku nekk gis na ne di nga xam am na koo xam ne am na ko wala am na ko mu faju wala am na ko yàlla yóbbu ko mu fa mu ngi fii ci suñ biir te covid bi demangut maa ngi ñaan suma mbokk yi ne ñu def li nga xam ne xam nañ ne dafa work mooy ne ñu yokka li ñoo raxas suñ loxo yi ñu ko def li ñoo def masque soxlut sax masque soxlut sax surgical mask morso boo am sax morso bu set rek nga jël ko muure ko sa kanam bi sooy jëfandikoo nit wala sooy génna loolu yëpp dina wàññi feebar bi parce que feebar bi dégg nañ ne amangut luñ ko fajee amangut garab amangut vaccine duma seetkat de waaye foog naa ne xam naa ne balaa at bi di jeex duñ gis vaccine dinañ ko covid bi dina nekkaa ñun ba ca kanami kanam ba ca kanama kanam so ñun ñëpp war nañu fartandeku ñu seetaat suñ boppa ñu wàññi génna bi soo soxlu pour dem béréb nga toog sa kër soo soxlu su fekkee ne dëj dafa am wala ngénte dafa am wala taka dafa am loolu yëpp mun naa xaar kenn nit nga ring jaale nit ki wala kenn nit dem ca takaba wala ñaar ñetti nit dem ñoo watee parce que loolu lañ xam ne suñ wàññee loolu dina wàññi jàngoro bi te tamit lii du jàngoro boo xam ne dañ ko nuba su fekkee ne mu ngi ci sa yaram nga yëg ko li nga xam ne yaa ngi ko jëfandikoo kër fajul la nga dem ci health center bi nga dimbale sa boppa dimbale sa waa kër xam ngeen ne ñun suñ dëkkuwaay yi niñ mel ñu ngi dëkkaa suñ yaay yi ñu ngi dëkkaa suñ nijaay yi ñu ngi dëkkaa suñ sët yi ñu suñ toppatee suñ boppa suñ toppatoo suñ boppa dinañ mën a toppatoo dimbale suñ ñiñ dëkkal ba pare tamit xam naa ne Gambia neexut waaye ñu seet tamit suñ liggéeykat yi ci biir kër gi naka lañ leen a mun a wàññee wala ñu seet su fekkee ne yaa ngi am ñaari mbindaan nga seet na mun nga jëfandikoo benn mbindaan su fekkee ne danga amoon driver nga seet na mun nga seet ndax nga mun a dem sa yow sa errand yi nga war a dem nga bàyyi driver mu dem yow nga dem toppatoo noonu parce que nit ñi dem ak a ñëw tamit ci biir kër yi loolu tam dafa yokk feebar bi so ñu seet daal si suñ boppa ñu seetaat ñu xam ne lii mu ngi fi for a while demangut so ñu suñ ne toppatoo suñ boppa ñu déglu li ñoo wax foog naa ne dinañ mun a wàññi numbers yi su nekk ni yëf yaa ngi fi torop te li xew Angleterre xew America xew Europe yàlla tere ba tereet ko bu mu xew Gambia parce que comme li Ebou wax we're only 2.4 million bariwuñ loolu rek la amoon pour wax.
Yeah, thank you very much, Dr. Fatou Wadda. I don't know, I think we lost our honorable MP. I reserve a very big question for him from the viewers, but maybe somebody tip him off and he's gone. I hope we can get him in the next minute, or else I will use Mr. Cham to close this program. And the question is, there was a serious financial allegation embezzlement at the Ministry of Health. Sorry, let me take this from Ben for a minute. I will be back. Yeah, at least the honorable MP gave us a heads up. So it's not his fault entirely. Nawek went off in Banjul, so he cannot lock me back. You know, but the question was about the serious financial investment at the health ministry, which was made by the health ministry. I was going to, one of the panelists, one of the viewers was going to ask him if they have launched any kind of investigation in that. Ben, if can you hear me? Ben, can you close this program then in the position of the Honorable Minister? Before Ben starts, I just want to take this opportunity to thank you guys massively for joining Gunjur TV Online for this brilliant program. And I believe the Honorable MP got his bag full with a lot of information and also willingness from the diaspora to lend their support. Now the onus is on the Gambia government and also our lawmakers to make sure that they open their door, that we are part of that country. Most of you guys are well established in wherever you are, but they said blood is thicker than water. Whatever you achieve in foreign land, you can see your relative going through this difficult time, and you sit and be comfortable. So we'll go back to Suleiman Ben Suare, who is a regular here, and also an expert about Gambia affairs, and again, another diasporan who never actually took off his glove. Because when we send the dictator packing, some of us just throw our gloves away, but Ben never did. He stayed in the fight, and it looks like the struggle is back on. Ben, welcome. Thank you.
Thank you very much. Thank you very much, Ahmed. Thank you very much for hosting this important program. I would take this opportunity. You just threw me in the deep water. I was not expecting to come on, but a brilliant job. I take this opportunity to thank the panelists, thank the member of parliament, the chair of the health select committee, Mr. Sillah, and for with all the challenges on the ground coming on to take part in this program. I thank every panelist on this program, for the contribution and on these issues, and I hope that we can have this conversation going. We expecting to host another one on Friday, and we thank the viewers and the listeners for their contribution and for sharing this program. My suggestion would not be much apart from to go round. I think Mr. Dibba wanted to have a comment, and just for them to have their final note. and then we'll have to close the program. But my colleagues, Babu Job, Demba Balde, Paradise TV, and all the other, Babu Job from Diasporum, Demba Balde from the Gainako online radio and paper, and the people that have managed to organize this program, they and team, the Gambia House network. Guys, I would just pass it on to Mr. Dibba to have their final comment, and I will come on and we have a closer. Mr. Dibba.
All right, thank you very much, Mr. Suare. I just wanted to bring this a little bit closer and, kind of put it into perspective. I would be very, very brief. To all the people that don't believe that COVID-19 exists, to all the people that think that, you don't have to put on a mask, you don't have to you don't have to practice social distancing. This is what I would like to say to you, and this is how I felt. To me, I brought COVID-19 to my home. I brought it to my family. The very people that I care about and love so much, the very people that I am responsible for. The outcome could have been different. Me being dead, that would have been, a lesser of the other option. What if someone within my family died because of the COVID that I brought home? That was a thought, that was always replaying in my mind during this entire period. So to save all of you this anguish, this thought, this feeling of helplessness, please, even if you don't believe that COVID exists, take the necessary precautions. And they are simple. Put on a face mask whenever you are in public, practice social distancing, and only go out when it's necessary. When it's not necessary, stay at home and stay blessed. Thank you.
Thank you, Mr. Dibba. Can I have Dr. Fatou Wadda before we move on to the next, please? Thank you.
Sorry.
Yes.
I forgot to unmute. I cannot say much more than what Karim has said to our people. That COVID exists, it is out there. And since the beginning of the pandemic, this has definitely my biggest fear that the numbers in the Gambia will start to rise, either gradually or at an exponential rate. And we can all see it now. I personally have had colleagues who have had COVID. Some have recovered. Some, unfortunately, have not recovered, both here in the UK, in the US, and back in Nigeria where I trained. So, like Karim said, for those who do not believe that COVID is there, it is. And for us to go in our homes every day to help people who are suffering, or just to do our normal work, we are putting our lives at risk. We are putting our families' lives at risk. So therefore, if we can take the necessary precautions, I implore you to please take the necessary precautions as well. They are quite simple, they are not complicated, and we've heard them over and over again. That was my last plea.
Thank you, Dr. Fatou Wadda. Mr. Cham?
Thank you. Well, just a quick synopsis of what we've been talking about. I think it's important for the government to continue securing our borders, or to continue supporting the health officials who are leading the fight against the virus in our country, and also to help enforce public adherence by maybe using the security forces to help out with that. The health officials, thank you. Continue to decentralize resources, and we appreciate your work. I know it can be very difficult, but you are leading the way, and we do appreciate what you guys are doing. For the civilians, take individual responsibility, engage our families and friends to help fight the COVID. Finally, for the people in the diaspora, my fellow Gambians and people of Gambian descent living in the diaspora, one thing we've not talked about is how we behave when we go to Gambia. You see someone who wears masks, follows rules and regulations, and for example, the United States of America, travel through the security airport and on planes and all the way to Gambia, and somehow you bribe your way or fight your way, bribe your way out of quarantine or fight with the immigration agents just so that you don't follow the rules and regulations that we're all encouraging for people to follow. So we have to be the change that we need. And it's really disheartening to see people following rules in other countries, and then you go to your own country and act like somehow all of a sudden you're invincible. And that's sort of my final
Thank you.
thing I wanted to put across.
Thank you very much. Thank you very much to all my colleagues for taking part in this very important program. And thank you very much for the panelists for coming on. And thank you very much for the MP for coming on and the taking part in this program. And I just have to close this here and to remind people the most powerful message that came to the final words. It's Dr. Ceesay have dropped out. Dr. Ceesay is not here. The most important message here is the personal message that came out from Mr. Dibba, the personal responsibilities that we owe ourselves, our families, and to our health worker, frontline workers. And let us remember that we will fight COVID and will defeat COVID, but we will need our health workers to be here for the other issues we have to deal with. And we have to take this personal responsibility. And we have to evoke the community spirit and fight this COVID together, and we shall win. Thank you very much, guys, and we hope to meet again in a better time to continue the discourse not only on COVID but all the other important issues, especially on healthcare. We are coming back Friday the same time. And now we will deliberate on this. Thank you very much, and have a good night.
Ben, just a minute, just to say thank you to the organizers, and also having the confidence in us, Gunyu TV Online. We are up and coming. We are here to establish. So when this was all organized, it was never our idea. We are called upon, and we are happy, because we see it as a service to the nation. We are grateful, and thank you very much for the effort you are doing, Dejuvat and the team. Ben is going to be here again tomorrow. Anyway, thank you,
thank
Demba
you
Balde. Unfortunately, your question cannot be put to the honorable MP. I know he will be happy to answer that one, but unfortunately, Nawek did it again. They never fail to disappoint. Thank you.
Demba, you want to have a word before we close?
Yeah, exactly. Yeah.
Okay, thank you. Thank you very much. Babu is behind the scenes, and we hope to have them all on Friday to moderate. Thank you, guys. Cheers.
Thank you. Thank you.
Thank you.
Here are 5 ways you can help combat stigma and discrimination as we fight against coronavirus COVID-19. 1. Educate your friends and family that COVID-19 is not specific to any race, nationality, or skin color. 2. Do not associate migrants with the virus. In many contexts, migrants are healthy and key players in nation building. 3. Remind others that discrimination may lead people to hide their symptoms rather than seek treatment. This puts everyone else at risk. 4. Be kind, considerate, and helpful to others in these difficult times. 5. If you know anyone experiencing symptoms, encourage them to dial 1025 for free.
bunda lulolti isi fam ma ko no foy si tanka kaja fo ning fatan fansola pour que ñing corona jangaro kele bunda folo ela ka fuñol ni la dimbayal kala mutandi ko ñing corona jangaro bu ka jibe e musi jumalati warante e bota banku jumalato walla e bawlo la kuloro mu kurola jumalati bunda fulanjang ikanaje ko tamalal dam male ka ta ñing corona jangaro soto fanna jama yayi tandile ko ñin tamalal jama jaato kende yatale andum ke kataku jamale ke banku do ko kono bunda sabanjang mol hakkilo bulandi ko ño kajafo ning fatam fanso satin nanni nole fan fo modol sila kurango mabo puli kanata jaarorola andum ñin si mobe dundi no mantoro konole bunda nani jang al nga bala fa ñoye nga ñoma koy bunda lulu jang nie molo meye atenyum corona kurang la mandar go sodo afoye 1025 command andum ite fen jola
ɗiɗo ko laawi joyɗi wawete rewde hara en aybinani en bonani fi haɓagol coronavirus ko adi kon jangine e ɓeengure mon e weldiɓe mon hara on darani leñol ma koddigagu ko ɗimmi kon wata on ɓaɗoɗe kawtal leydi men jogiiɓe nde nawnare a wiyaka non kawtal leydi be ko jogiiɓe nawnare nden tun ko tammiti kon aybingol jogiiɓe nde nawnare waɗay ha en wawata andude goɗɗo goo sino jogii sabu natima waɗay ha ɓe hersira te ɗum no bonani en enen fof naya ɓunɗum tambitoɗe moƴƴe andite ɗum koko feƴƴata joya ɓunɗum si tawi no woodi mo sikkitiɗon walla anduɗon jogiiɗo nde nawnare wata on aame nodde 1025 no yawiri
nañu booloo xeex xaajaarleeg xeet yi di xew ci jamono gi coronavirus xewee juróomi anam yiñ mun a jëfandoo mooy benn nañuy jàngal suñuy xarit ak jaboot yi ne coronavirus amut xaajaarleeg seen ñaar bu ñu tiiñal gan yi ak am di jaama réew mi ndaxte ci lu bari gan yi am nañ wérgu yaram te bokk nañ ci dooleel koom-koomi réew mi ñett nañu fàttali suñ boppa xaajaarle yi mun naa tax képp ku am màndarga jàngoro gi du feeñal boppam wala sàkku ndimbal te loolu mun naa indil ñëpp loraange ñeent nañu laabiir te ubbi suñu xol yi ci bépp doomu aadama ci jamono tolof-tolof yi juróom képp kuñ xam kuy wone màndarga yi wala am jàngoro gi nañ leen ñaax ñu woote ci 1025 te doo fay dara